Hey everyone, it's Zohran. Today we have Mariam Shariat. She's a co-founder of the Astoria Mutual Aid Network, a collective that our campaign is so proud to be a part of. Mariam, to start off, can you tell us what brought you to Astoria and how you've experienced a sense of community here?
Yeah, I am really excited to be an Astoria resident for the last 4 years. Uh, Emma, what are you doing? Okay, can you go upstairs, please?
No, fine.
Thank you. Sorry.
Totally fine.
Um, so I've been living in Astoria for 4 years since I met my now husband. We were dating, yeah. And I lived in Brooklyn and he lived in Queens and he had a kid, so there wasn't any bringing them to Brooklyn. So we've lived in the same apartment for 4.5 years now. And it's really interesting because we live on the Long Island City border of Astoria. So depending on what map you put it in, it's an LIC address or an Astoria address. And we live on in the Bangladeshi hotspot right off 36th Avenue, which I think is like a really unique Astoria experience because it's being gentrified, but is not yet gentrified. And so it feels very like communal. Like I see the same people every day. Very few like high-rise fancy buildings near us. A lot of low-rise like buildings that are owned by families and teams, which is great to see.
Yeah, I think it's so people have very kind of singular understandings of Astoria and depends very much where you live and what communities you're a part of that informs how you think of the neighborhood. And there are too many people who don't know about 36th Avenue and all of the great places to eat.
Oh my gosh, so good.
So I wanted to ask you a little bit about AMA, Astoria Mutual Aid, and I wanted to ask you, why did this start? Why is it important? And what type of work have you all been doing?
Yeah. Why it started was because my husband and I have the good fortune of being able-bodied, not vulnerable to COVID-19. And honestly, it started because we had to cancel our daughter's spring break trip. And she's a very civically minded, like young kid who was really upset, obviously, like missing going to Disneyland. We all were upset. But we knew the thing that would really make her refocus her on our kind of change of plans was that we were doing a service to our community. It was socially responsible for us to stay in Astoria, and by staying in Astoria, we could make sure that our vulnerable neighbors didn't have to go to the store and that we could kind of help them out. So it started with that. It quickly went to a flyer we printed out on our home printer. And then we just went around on a Saturday morning and started putting them up. I took a picture of it. I posted on my Instagram and tagged all the sort of local Astoria accounts. And really quickly, we got like 100 volunteers within a couple days. And now we're almost 600 volunteers, which is really amazing. And the intention and sort of the thing that I think is most important to know is that Astoria Mutual Aid Network is not backed by any organization. We have both your team and your campaign involved. We have our other like local electeds who are involved. We have members of like the New York City Housing Authority involved. We tried really hard to cast a wide net to make sure that we were as best as we could at the start, representing a lot of different voices, just to be able to simply be neighbors who were helping our neighbors. We are, I like to say, just like a guerrilla group of neighbors just trying to help each other out, which is really what we do. We pick up groceries for people who don't want to leave the house. We pick up pharmacy prescriptions. We have people with chronic illness that need to get to doctor's appointments. So we help, we pay for their Lyft, their car share service to get there so they don't have to go into transit and put themselves at risk. And a lot of it is simply just reaching out and checking in on people. Through the political affiliations we've been able to get access to voter information and be able to call all of the constituents, it's an old record, but all the constituents in Astoria over 65 and let them know that like if they need something, we're here. Because I think a lot of what's happening for mutual aid is digital and a lot of Astoria residents are not digitally savvy. So we've been really working really hard to try to make sure that our flyers and sort of name get into places regardless of your access to tech.
Absolutely. That's fantastic. And in setting this up for you and Ross, and the hundreds of people that have now joined, had either you or Ross ever done kind of community organizing or mutual aid work like this before, or did you feel this moment was important enough to get you involved for the first time?
So, yes and no. I have no formal organizing or mutual aid experience, and I'm not affiliated with any sort of organizations that do that work or organize in any way. Ross is a former like political organizer when he was like in college and immediately post college. We both work in the nonprofit space, so I think the idea that taking care of people who aren't as privileged as we are is critical to sort of how we live our lives. Um, and honestly, for me, that I think for both of us, the biggest thing was we didn't know how we were going to make it through this experience if we didn't have some way to know that we were contributing in some way. Um, and totally legitimate for some people that like the most they can contribute is simply staying inside. I have too much energy for just that to be my contribution. So, and honestly, for our daughter to show that like we were using our privilege towards something bigger was probably the biggest impetus. It's been scary because I'm not an organizer. I'm meeting a lot of people who are years-long organizers. And it's always interesting to be like the new kid in the room, especially when you have ideas that might not be consistent with the ideas of people more established. But I also feel like at this moment, if you're willing to contribute anything, then your voice is just as good as anybody else's.
Absolutely. And I think that what you and Ross and so many others have now created is testament to that. That, there should not be a barrier to entry into organizing. And look at what can be done when everyone is welcomed and allowed to create something like this. In terms of, you're saying the kind of the calls that you've been doing, the outreach that AMA has been doing, what has the response been like in terms of people wanting to help out and be of service, as well as people who are requesting help?
Yeah, I mean, we definitely have more people wanting to help than we have people requesting. Especially until New York put the state on pause, people were still going to stores and things, so I don't think they were asking for help just yet. Um, we're definitely seeing an increase in people reaching out to us. So we have a email account, a phone number, and a sort of web form to receive requests. And I would say until this past week, we were getting maybe 2 to 5 requests a day, and only a few of those needing actually a volunteer. A lot of people just asking for information. Where can I find this? Or who do I contact for this? But in the last few days, especially, we've been getting between 10 and 20 requests a day. And a lot of them requiring a volunteer to sort of leave their home and take care of something. Because I think people are just, it's getting real.
Yeah, it absolutely is. And when we're talking about it getting real and people needing this kind of increased need for help, what are the types of things that people are struggling with the most? And what are you hearing from community members about how people are generally coping with this moment?
Yeah, I mean, I think honestly, one of the unexpected bright spots in this, I think, is simply knowing that your community is there for you. So we've heard from a lot of people, even if they don't need support, that the fact that we call them every 3 to 5 days, just to check in on, do they needed groceries last week? Do they need us to go out again? Or, they called us because they were feeling socially isolated, and we want to make sure that they're doing okay. They have access to sort of crisis counselors if they need them, but really they just want to know that they're not alone. Um, I think that's been one of the bright spots of folks just saying like the fact that I know I can call you is a huge help in and of itself. But when we get into the sort of the tactical needs, much more we're hearing from people who are non-permanent workers, so restaurant workers, bartenders, gig workers, freelancers like myself that are out of work, and are worried about how they're going to buy food for themselves, let alone if they have kids, or someone in their household is positive, COVID-19 positive or presumed positive if they haven't been tested, and they're scared, like not sure what to do, certainly don't want to leave the house themselves to go get groceries for the household. So a lot of the volunteers we deploy are specifically are for people who, for some reason or another, don't feel comfortable leaving the home, whether they are vulnerable or think they've been exposed or just not feeling that well. That's largely how we're deploying our volunteers at the moment.
And do you think that there are sufficient resources out there for people such as these who are struggling, or could the state be doing more? And if so, with that, what are the types of policies you think the state should be pursuing to ease people's burdens?
Yeah, I mean, I tend to hope and assume that everyone's doing the best they can at every moment. Um, I think it's unfortunate that we're kind of in a societal moment where access to support and resources is so centralized. Our food bank system is doing the best that they can, but they're certainly not equipped to do home deliveries for everybody that might normally access a food pantry. Meals on Wheels is an incredible organization, but they're not equipped to do home deliveries for all of the elderly folks that access their programs. Um, so I think from the nonprofit sector, in my experience, limited as it may be, I think everyone's doing the best they can and being adaptive and agile. But their staffs are also affected by coronavirus, right? Like they're getting sick, they're running on lean teams, they've had to adjust their budgetary expectations for the future. I'm a nonprofit event planner. I had 3 galas I was working on in the next 3 months. They're all canceled. So those organizations are now without anywhere from $500,000 to $1 million worth of their budget for the year. That's significant. Like that affects people. I don't know enough about how the state and city and things run. Um, it's challenging to get connected to structural resources. I've and members of the kind of AMA core team have tried to reach out to different agencies to get a conversation. Like, how do we help people with food stamps who can't leave the house? And we kind of haven't been able to make the connection. And I think it's hard to plan longer term when you're in the middle of a crisis. But I think if our organizations and nonprofit partners and states and city governments don't allocate some resources to plan for the next 3, 6, 12, 18 months, we're going to have a really hard time making it through this without some real damage on our communities.
Absolutely. And I think that it's organizations such as AMA that are keeping people afloat, and now it's a vision that we all need to kind of step up to, of how do we make this sustainable.
Okay.
How do we ensure that, as you were saying, people can, if you have food stamps, you can't leave the house, you can still have them used by someone who can bring the groceries to you, that we can take off some of the burdens on people's financial situations, whether it be their rent or whether
Yeah.
it be their utilities. Um,
I mean, the MTA still charged unlimited MetroCard passes after the state had gone on pause.
Yeah.
Like, that's not helpful.
Yeah. And I think that it's exactly what you're saying about needing to now plan out and recognize that the future, for the foreseeable next, for the few months at least, is going to look a lot closer to this than what we had prior to COVID-19.
Yeah.
And we need to have policies and practices that reflect that. And so the final question I wanted to ask you is, what are the total list of services that AMA offers, and how can people get in touch, either if they want to help out or if they need those services themselves?
So the list of services grows when someone asks for something new.
Okay.
We had someone recently whose husband needed to go to the hospital. Their partner was presumed positive too if they were experiencing symptoms. They had a dog, and their husband didn't want to leave the dog at home alone, like not knowing who could care for the dog. So we hadn't previously provided pet care, but then we, found a volunteer who's a qualified pet sitter who was willing to take this dog and foster it until its owners are able to be home and safe. So I think the list grows. I would say primarily, like, the things you can always call and check in with us for are accessing, if you're a vulnerable person, you want to access groceries or you need pharmacy pickup, we're here for you. That does not include people who are able-bodied, who are healthy, who just want to mitigate their own risks, because that's not really fair. But if you are an elderly person or otherwise vulnerable, or have kids at home and can't leave or whatever, give us a call. Same with pharmacy prescriptions, same with just accessing food resources. We are not an organization with funding, but we are in constant communication with different food banks and are trying to keep a kind of current understanding of where you can access free food if that's what you need. And so if that's a question you have of how do I access a food pantry when I can't leave my house, or just even if you can, call us. We are keeping that information as best as we can. If you're feeling emotionally unwell and need some guidance, we have the list of resources that you can access for behavioral health and sort of therapy over the phone that we can share with you, all sorts of things. But the best way to reach us, we have 3 major lines of getting in contact. So our website is astoriamutualaid.com. Hopefully that's really easy. On that site, you'll find a phone number, and our dispatching team is receiving calls, emails, etc. from 8 a.m. to midnight, 7 days a week. So you can call 646-397-8383, or you can email us at astoriamutualaid@gmail.com and follow us at that place on all social too.
That's amazing.
Yeah.
Well, thank you so much for taking the time to talk about AMA, the amazing work that you've done, and the ways in which people can get involved and request help.
Thank you, Zohran. It's so great to connect with you, and thanks for encouraging people to both ask for help and give help when they can.
Amazing.